Have you noticed changes in your size or firmness during sex and quietly wondered if there's something you can do about it? I'm Dr. Laura, here to help men understand and make sense of the changes that happen in their bodies as they get older. With age, a few things naturally start to shift. Blood vessels can become less flexible, testosterone can drop, and the pelvic floor muscles can weaken. The pelvic floor isn't just about bladder control, it's a group of deep supportive muscles that directly affect your ability to get and keep an erection. Two key ones are called the bulbocavernosus and the isocavernosus. Most men have never heard these names, but these muscles work hard behind the scenes. The bulbocavernosus muscle squeezes to trap blood in the penis during arousal, keeping it firm and steady. The isocavernosus boosts that pressure and helps keep the upward angle many men associate with youthful performance. Together, these muscles press on important veins and support the erection from inside the pelvis. When these muscles get weaker or lose coordination, which often happens with age, long hours of sitting, prostate issues, or simply not using them, blood can escape more easily. The result: erections that don't feel as firm, seem shorter, or fade faster than before. This is where pelvic floor muscle training, or PFMT, comes in. It's a set of focused exercises that target these exact muscles, rebuild control, and restore the inner pressure that helps you stay firm. If your aim is to feel stronger, fuller, and more in control of your body again, this might be one of the most overlooked tools you can use. Now that we understand what the pelvic floor muscles do, let's look at what research actually shows, especially for men over 60. In a randomized controlled trial by Dr. Gray's Story, researchers followed men with mild to moderate erectile difficulties. After only 6 months of regular pelvic floor training, over 40% got back to normal erectile function, and another 35% noticed better firmness, control, or satisfaction. That's more than 3 out of 4 men seeing real improvements. And here's the thing: they didn't change their medication or have procedures done. They simply learned to work a set of muscles that had quietly weakened over time. So what's behind these results? It comes down to something called veno-occlusive function. Strengthening the bulbocavernosus and isocavernosus muscles helps this valve system work better. You build the pressure needed to hold blood in longer, leading to harder and longer-lasting erections. But strength alone isn't the whole story. Many men, especially after 60, need not just muscle power, but also neuromuscular control, the brain's ability to quickly signal the right muscles at the right time. That's where biofeedback makes a real difference. Biofeedback gives you instant information about how your muscles are working, using gentle sensors, guided apps, or clinical tools. It teaches you when and how to tighten the pelvic floor, and just as importantly, when to relax it. For older men, this can make learning faster, less frustrating, and more effective in daily life. There's another bonus worth noting. These same muscles also help with bladder control, prostate health, and recovery after surgery. Even if you don't have urinary or prostate issues now, keeping your pelvic floor strong can help you avoid common problems later on. Best of all, pelvic floor training is low risk when done properly. It won't interfere with medications, it doesn't require surgery, and for many men, it offers a feeling of control, especially for those tired of relying on pills that may lose their effect or cause side effects. For many men noticing a gradual drop in firmness, fullness, or stability, pelvic floor training is a proven, practical, and empowering first step. Most men start seeing subtle changes within a few weeks: better muscle control, more responsiveness during arousal, and sometimes a firmer upward angle. But like any kind of training, real progress comes with time. As we discussed earlier, 2 muscles are key to this: the bulbocavernosus and the isocavernosus. When both of these muscles are strong and well coordinated, the result is an erection that is not only firmer, but also more stable and longer lasting. You might notice better angle, more fullness at the base, and improved sensitivity because the nerves and blood vessels are being supported properly. But when these muscles weaken, which naturally happens over time, especially without targeted use, blood tends to escape too early. The result can be a flatter or softer erection. Many men also report that their erections look shorter or smaller, even though the actual size of the penile tissue hasn't changed. And this is where we get to the idea of perceived size. Technically speaking, pelvic floor exercises do not increase the anatomical length of the penis. That's not what these muscles are designed to do, but they do increase the pressure and fullness of blood within the erectile chambers, and that can change how the erection looks and feels. There's also a neurological component to this. When these pelvic muscles are activated correctly, the brain often experiences improved sensory feedback. That means you don't just feel stronger physically, you also feel more aware and connected. Many men describe this as having better control, better rhythm, or even more pleasure during intimacy. That's not a coincidence. It's the result of improved communication between the brain, nerves, and pelvic floor. It's also worth mentioning that strengthening these muscles can help reduce strain on other systems. For example, many older men compensate for pelvic weakness by overusing their abdominal muscles or holding their breath during intimacy, which can raise blood pressure and lead to unnecessary tension. A well-trained pelvic floor allows for more natural movement, less fatigue, and fewer distractions, all of which support a healthier experience overall. And while results vary from person to person, most men who commit to pelvic floor training for 8 to 12 weeks report better angle, longer duration, and improved confidence in their erections, even if the actual dimensions remain unchanged. So how do you actually begin? The good news is that pelvic floor training doesn't require equipment, gym access, or invasive procedures, but it does require consistency and a bit of patience. The first step is learning to identify the correct muscles. The easiest way to find them is during urination. Try gently stopping the flow midstream. The muscles you use to do that without clenching your thighs or holding your breath are part of your pelvic floor. That's not a training technique, just a one-time test to locate the right area. Once you've identified the sensation, you can begin practicing outside of the bathroom in a more structured, controlled way. Start by sitting or lying down in a relaxed position. Take a few normal breaths, then gently contract those same pelvic muscles, as if you were trying to lift or hold something internally. You shouldn't feel tightness in your abdomen, legs, or chest. If you do, ease off and refocus. The goal is to isolate only the pelvic muscles. Try holding the contraction for 3 to 5 seconds, then fully release for another 5 seconds. That release phase is just as important as the squeeze. Over time, you can gradually increase to 10-second holds with full control. Most men benefit from doing 2 to 3 sets of 10 repetitions per day. You don't need to do them all at once. A few gentle rounds in the morning, afternoon, and evening can fit easily into most routines without strain or discomfort. Now, here's where it helps to think like an athlete. You're not trying to push harder every day. You're training for control, not power. And like any skill, the early results are often subtle. Improved awareness, easier muscle activation, better stamina during intimacy. These small improvements build the foundation for more noticeable benefits down the line. If you've tried before and felt unsure whether you were doing it right, you're not alone. As mentioned before, many older men benefit from biofeedback guidance. These tools can accelerate progress, especially if you're someone who learns best by seeing or feeling direct feedback. That said, many men make excellent progress with basic daily practice as long as they stay consistent. Here's what most men can expect over time. Weeks 1 to 2, you may start to feel more connected to the muscles, even if the contractions are still weak. Weeks 3 to 5, improved endurance and confidence, with less effort required to engage the muscles. Weeks 6 to 8, better control during intimacy, improved stability, and for some reduced urinary leakage or urgency. By week 10 to 12, noticeable improvements in firmness, angle, and for many, enhanced perceived size, especially if blood flow was a limiting factor before. Along the way, it's normal to have ups and downs. Progress isn't always linear, but if you stay the course, you may be surprised by how much difference a few minutes a day can make. And remember, these exercises don't just support erection quality, they help with bladder control, post-prostate recovery, and even reduce the risk of future pelvic instability. So even if intimacy isn't your main concern, pelvic floor training is still a smart investment in your long-term health and confidence. If this helped clarify things, consider subscribing. It's a small step that helps more men find accurate, shame-free health information, just like this. And if you decide to begin pelvic floor training, know that it's a doctor-approved approach that's safe for most men over 60, and one that's helped many feel stronger, more in control, and more like themselves again. And always remember, all information provided in this video and channel is for educational and informational purposes only. Always consult a medical professional about your specific circumstances and before making any changes to your lifestyle, diet, supplements, or medication.